Hello guys, welcome to our second episode of Board Exam Essentials, and of course these are your pre-board examination for Nursing Practice 1, questions number 21 to 40. So these are former board questions which could actually be of help especially in the preparation of your board examinations, especially for the nurse licensure examination here in the Philippines. So let's begin with our question number 21 to 40, but of course this time we'll have to employ our test taking strategies in which on the first reading of the question we'll be able to eliminate the two choices in the first reading. Of course, in the second reading we'll be giving you the second or the best answer for that question. Let's have now question number 21. Situation number one. All individuals share basic needs that are necessary for their survival. Nurses should be sensitive towards these needs since they are important factors that will determine the plan of care. Question number 21. Which are the following statements about man's basic needs is correct? Take note of the word man's basic needs. Of course, if we're going to talk about man's basic needs, we're actually going to have in mind the Maslow's hierarchy of needs. Letter A. Hospitalized clients have basic needs that should all be met by the nurse. Letter B, basic human needs are the same in priority in all individuals. Letter C, environment has nothing to do with the ability of man to meet his needs. Letter D, unmet needs render the individual clients at risk for illness and or complications. So in this question, we'll eliminate immediately choice letter A and also choice letter B, because of course choice letter A contains the absolute term all, and also choice letter B contains the word absolute words all. In any examinations wherein there is an all, which is actually an absolute term, that's gonna be 95% wrong. Let's dissect. Letter A, hospitalized clients have basic needs that should all be met by the nurse. Of course, we're composed of a healthcare team, so the care has to be given by a team, and it's not be given only by a nurse. Letter B, basic human needs are the same in priority in all levels. Of course, it depends on the need of the patient. Of course, that actually be based on the basic needs of the patient, but of course it is not the same in all levels. Let's read the question again. Which of the following statements about man's basic needs is correct? Letter C, environment has nothing to do with the ability of man to meet his needs. Or letter D, unmet needs render the individual clients at risk for illness and or complications. So the best answer for number 21 or question number 21 is letter D, because when you talk about unmet needs render the individual clients at risk for illness or complications, this is addressing the physiologic needs of the patient, especially on Maslow's hierarchy of needs. Letter C is also eliminated because it says that environment has nothing to do with the ability of man to meet his needs, and according to Florence Nightingale, the environment is very important in order to aid in the recovery of the patient. So the best answer for number 21 is letter D. Let's proceed now to question number 22. Same situation. Which of the following client groups require the fullest resistance in meeting their physiologic needs? Take note of the word client groups and of course fullest resistance. And of course, let's letter A toddler with venoclisis and under treatment for LBM. Letter B, a severely malnourished school-age child. Letter C, premature infants. Or letter D, a 6-year-old admitted for parasitism and ambulatory. Okay, let's eliminate two choices immediately. Eliminate letter B and letter D, because letter B is the same. The patient here is school age, and letter D as a 6-year-old, as what I've mentioned in our previous discussion. If there are two choices in an examination that has the same thought, it's gonna be wrong. So we're left with letter A and letter C. Letter A, a toddler with venoclisis and under treatment for LBM, or letter C, premature infants. The question here is client groups and fullest resistance. Of course, when you talk about client groups, these are individuals who are actually at risk, and of course fullest resistance is basically this client requires specific management, and of course in that case there's a need for this patient to be given in intensive management. So the best answer for number 22 is letter C. premature infants. Premature infants require management in an intensive care unit because, of course, there's a need for this premature infant to have this management is because, of course, of the need that he has. And of course, a toddler with venoclisis. So, of course, in this case, the patient here is already having venoclisis, and of course, the patient has been managed with LBM. So, there is already a management of LBM with the use of your venoclisis. So, in this case, the best answer for number 22 is letter C, premature infants. Let's now have question number 23. Same situation. Which of the following age groups are at greatest risk for unmet needs? Take note of the word groups and unmet needs. Is it number one, very young, number two, very old, number three, adolescent, and number four, school age children? Okay, if you are going to take into consideration here greatest risk of unmet needs, our priority here is to focus on the very young. So number one is actually correct, so we're left with letter A only. So the best answer for number 23 is going to be letter A. Why? Because of course the greatest risk, the greatest groups, the groups that has the greatest risk for unmet needs are the very young and also the very old, because of course they might not be able to do it themselves, especially if they're not anymore capable of doing those activities of daily living in order to meet their basic needs. Let's now have question number 24. Same situation. Which of the following needs is a primary consideration in determining the priorities in meeting clients' unmet needs? Take note of the word primary consideration and clients' unmet needs. Letter A, self-esteem needs. Letter B, security needs. Letter C, physiological needs. Or letter D, spiritual needs. First reading, eliminate two choices. Eliminate choice letter D. Because, of course, according to Maslow's hierarchy of needs, there's no spiritual needs. And take note of the word primary consideration. Eliminate letter A, because self-esteem is not a primary consideration for patients, especially in focusing on the patient's unmet needs. So we're left with two choices. Let's read again the question. Which of the following needs is a primary consideration in determining the priorities in meeting clients' unmet needs? Of course, our primary consideration for patients, especially on the patient's unmet needs, is letter C. So the best answer for number 24 is physiological needs. And of course, when physiological needs are actually met, it will then proceed to security needs or safety and security needs. So the best answer for number 24 is letter C. Let's now have question number 25. 25. Which of the following observations is best closely associated with patient's physical safety? Take note of the word observations and of course closely associated with safety. So that's gonna be our keywords. Letter A, lack of confidence. Letter B, fear of the unknown. Letter C, skin breakdown as in bed sore. Letter D, threat to body image. First reading, eliminate two choices. Take note, letter B, fear of the unknown is non-existing. So therefore, it will not be an issue of safety of the patient. And then letter D, threat to body image. Threat means it's not yet existing. So that's gonna be futuristic, or it's yet to happen. So eliminate letter B and letter D. We're left with two choices, A and C. Which again, let's read the questions for the second time. Which of the following observations is best closely associated with patients' physical safety? Take into consideration safety issues. So the best answer for number 25 is letter C, and that's gonna be a skin breakdown as in bed sore. So the skin breakdown as in bed sore is going to be associated with the patient's safety because of course at this time the patient is already having break in the continuity of the skin, so therefore the patient here is already prone of possible infection. And of course letter A, lack of confidence, is basically not an issue of safety because lack of confidence talks about your self-esteem issue and self-esteem needs of your patient. So the best answer for number 25 is letter C, skin breakdown as in a bed sore. Let's proceed now to question number 26. Situation 2. Healthcare services are classified into categories. Nurses should be cognizant of this categories to be able to render appropriate nursing intervention. 26. Which of the following interventions are classified as primary care? Take note of the word primary care. Of course, we have these three levels of prevention, right? We have your primary, secondary, and tertiary. Just remember, primary is gonna be the patient is not yet sick. Secondary, the patient is already sick. The tertiary is rehabilitation of a sick patient. Let's have now letter A. Let's eliminate choices. Screening patients for tuberculosis. Letter B. Provision of direct nursing care to patients in the ward. Letter C. Counseling newly married couples on appropriate family planning methods. Letter D. Teaching diabetic patients how to self-inject. Let's eliminate for our first reading two choices. Let's eliminate letter A and letter B, because letter A from the word screening, that's gonna be secondary. Provision of direct nursing care, that's secondary. So therefore, we're left with two choices. Letter C, counseling newly married couples and appropriate family planning methods. Or letter D, teaching diabetic patients how to self-inject. So the best answer for number 26 is letter C. Letter C, counseling, is basically a health promotion activities. Letter D is actually talking about teaching, but here the patient is diabetic already. So if that is the case, that's part of the tertiary prevention. So the best answer for number 26 is letter C. Let's proceed now to number 27. Question number 27. Which of the following can be classified under the secondary levels of care? Take note of the word secondary levels of care. 1. Assisting in an open heart surgery. Number 2. Implementing direct observed treatment therapy in the rehabilitation control of tuberculosis. Number 3. Attending to the delivery of G2P1 mother. Number 4. Participate in the immunization campaign against policy. Number 5, doing active and passive exercise with a CVA patient after a bath. Of course, let's eliminate choices. That's first reading. Number 5 is specific for tertiary. So therefore, eliminate choice number or letter B and letter C. And of course, number 4, participate in the immunization campaign against policy. That is part of the primary. So that's gonna be wrong po yung number 4. So eliminate letter A. So the best answer for number 27 is letter D. 1, 2, and 3. Assisting in an open heart surgery, secondary. Implementing DOTS, that's already part of secondary because you're treating. And attending to the delivery of G2P1 mother, that's secondary. So the best answer for number 27 is letter D. Let's now have 28. Same situation. Applying sandbags against the sole of the feet of a stroke patient to prevent foot drop is an example of what level of care? So our keyword here is sandbags to the sole of the feet and stroke patient to prevent foot drop. First reading, primary care, acute care, secondary care, or tertiary care. Eliminate natin diretso yung acute care. Wala naman tayong acute care specific for the prevention. And of course, let's eliminate also your primary, because when you say primary, wala pong sakit ang pasyente. Take note of the word stroke patient. So therefore, the best answer for number 28 is letter D, tertiary. Bakit siya naging tertiary? It's because the patient is already sick and that is part of the rehabilitation program. Take note, it's not a treatment because this is actually in prevention of the patient to have foot drop. So that is going to be letter D. Let's now have 29. Same situation. Establishing a nurse-client relationship with a suicidal patient is an example of which of the following level of care? Take note of the word nurse-patient relationship with suicidal patient and level of care. First reading, tertiary care, B, psychological care, C, secondary care, or D, primary care. Eliminate immediately letter B because there's no such care as psychological care because we have three levels only: primary, secondary, and tertiary. And also eliminate letter A, tertiary level, because in this case we are not rehabilitating a patient, but we are in need to treat the patient. So that's the best answer. Is a second reading, establishing a nurse-client relationship with a suicidal patient is an example of which of the following level of care? Answer secondary. That's letter C. Why? Because the patient here is already having suicidal ideation, or there is already suicidal thoughts. So therefore, there's a need for us to make sure that this patient is gonna be managed in the hospital. Of course, in here, if that's primary, the patient is the nurse is only providing nurse-client relationship to a patient. But of course, there's no suicidal thoughts yet. Let's now have question number 30. Which of the following nursing interventions are considered primary care? That's primary care. Let's have number one, conducting mother's class on how to bathe newborns. Number two, conducting group classes on Lamaze technique to couples. Number three, conducting groups classes to diabetic patients. Number four, doing adolescent reproductive health counseling. Number five, doing health education classes on how to stop smoking. Of course, the number one, conducting a mother's class on how to bathe newborns, that's actually going to be correct. So eliminate letter B. Number two, conducting group classes on Lamaze techniques. So that's gonna be, Lamaze is actually a technique that will actually prevent the patient from having severe pain after or during delivery. So number two is also correct. Number three, conducting group classes to diabetic patients. Diabetic patients, that's gonna be part of the rehabilitation. So this is part of the tertiary. So wrong ang number three. Wrong ang number three. So the best answer for number 30 is letter D. 1, 2, 3, 4, and 5. Except letter or number 3, because diabetic patient, that is part of the rehabilitation. So therefore, that's gonna be part of the tertiary intervention. We're focusing here on the primary care. Let's now have question number 31, situation 3. Postpartum blues sometimes happen among women who recently gave birth. Number 31, research findings, the pregnant women have tendencies to have postpartum blues are those: A, high risk pregnancy; B, cardiovascular ailments; C, infectious cases; or letter D, primigravida state. So let's eliminate two choices. Remember, high risk pregnancy and cardiovascular pregnancy have the same thought, because you become high risk pregnant, especially if you have problems with the heart. So therefore, that is going to be eliminated. Eliminate letter A and eliminate letter B. Is it second reading? From research findings, the pregnant women have tendencies to have postpartum blues are those is infectious cases or primigravida. Take note, postpartum blues usually going to happen for first time mothers. So best answer is letter D, primigravida state. So if that's going to be primigravida state, there is a higher risk for this mother to experience this postpartum blues, especially if there is actually going to be no support system. Let's now have question number 32. Same situation. Postpartum blues usually happen within the, take note of the word recently gave a birth. In order for you to have any idea with regards to how you answer the question, go back to the situation. Again, 32. Postpartum blues usually happen within the A, first week; B, fourth week; C, second week; or D, third week. Eliminate letter B and letter D for the first reading. Why? Because third and fourth week is already considered to be totally late already after the delivery. So best answer for number 32 is letter A, first week and last 5 to 10 days. So that's gonna be extending to the second week. So of course, the postpartum blues usually happen on the first week after giving birth. So number 32 answer is letter A. 33, same situation. Postpartum depression, on the other hand, is more serious and lasts longer. The nurse should know that the cause from A, unrecognized and untreated depression; letter B, missing meals habitually; letter C, disorganized behavior; letter D, inability to sleep for a long hours. Take note of the word depression and more serious, and you have to remember also what is the cause of this one. So of course, when you're going to talk about the cause of this one, eliminate from the first reading, eliminate letter B and letter D. So in this case, inability to sleep for a long time and missing meals habitually is a physiologic condition. So therefore, that will not relate with the psychological problems of the patient. Letter A, unrecognized and untreated depression and disorganized behavior. Take note, there are also instances wherein there is a keyword in the choice that pertains to the correct answer of the question. Take note of the word postpartum depression, but of course that is also going to be related to postpartum depression or untreated depression. So the best answer for number 32 is letter A. Just remember, postpartum blues is going to be the first event that will actually happen. Next is postpartum depression, and of course, later is going to be the development of postpartum psychosis if the depression is not actually being treated. Let's now have 34. Same situation. One promotive measure to avoid postpartum psychosis is having A. Collegial friends and classmates. B. Good food and long hours of sleep. C. Outing and recreation activities. D. Healthy and supportive family life. Of course, psychosis. We're addressing here psychosis. Take into consideration that we're talking here about psychological problems. So therefore, wrong po yung sinasabi nating letter B, and also with letter C. Because letter B, good food and long hours of sleep, that's addressing physiologic need of the patient. Outing and recreation activities does not address what is actually the problem of your patient. So therefore, the focus here in order for us to prevent postpartum psychosis is to have this support system. And if that's going to be postpartum psychosis, our greatest support system is basically the family. So the best answer for number 34 is letter D. So the best answer is letter D. That's healthy and supportive family life, because of course your husband and of course your mother and father are basically the most important person in your life to support you with your delivery. So that's 34, answer letter D. Let's now have 35. Guilt feelings, when not verbalized, can be a factor in having which condition? Take note of the word guilt factor and condition. Eliminate immediately fear and anger. So first reading, fear and anger are basically not a condition. It is a symptom. So it's between depression and anxiety. Guilt feelings cannot when not verbalized, can be a factor in having a which condition. We know that anxiety is futuristic, and also we know that depression is also going to is going to happen in the future if your guilt feelings are not being verbalized. So best answer for number 35 is letter A, depression. Let's now have number 36, situation number 4. Miss Janet, a school nurse, was invited to speak at a career for high school students organized by the school. In the open forum, she was asked whether nursing is a profession. Number 36, which of the following best describes a nursing profession? A. It is a highly paid especially in the developed countries. Letter B, it is service oriented and a universal profession. Letter C, it is highly skilled and purely technical. Or letter D, it has a culture of autonomy in decision making, especially in responding to patients' nursing problems. Of course, eliminate two choices for the first reading. Eliminate letter A and also with letter C. Take note of the word highly. If wrong po siya sa isa, wrong din po siya sa pangalawa. And take note, high-paying job in developed countries. It might actually be true, but that is not the focus of nursing as a profession. And also, it is a skilled profession, but it's not purely technical, because of course we can do things to our patient via our therapeutic communication only. So the second reading, which of the following best describes a nursing profession? Is it service-oriented and universal profession? Or letter D, it has a culture of autonomy in decision making, especially in responding to patients' nursing problems. Of course, it is a service-oriented, but of course it is not actually required for everyone to engage in nursing. So the best answer for number 36 is letter D. It has a culture of autonomy. Of course, it has independence from other profession, and of course decision making is basically going to focus on the patient's nursing problem. So the best answer for number 36 is D. Let's have now number 37. When asked how do you define nursing, Miss Janet quoted the statement, "It is assisting the individual, sick or well, in the performance of activities contributing to health or recovery in a manner that will help the client gain independence." Who among the following is the source of this definition? Of course, that's the first reading. Virginia Henderson, Dorothy Orem, Clara Barton, Florence Nightingale. Eliminate two choices immediately. Answer, eliminate this letter B, and of course letter C, because of course there's no such thing as Dorothy Orem. We have Dorothea Orem. And of course, Clara Barton is gonna be the a newest form of nursing theories, but of course her theory is not focused on basically independence. So we're left with two choices: Virginia Henderson and Florence Nightingale. Of course, the focus of Florence Nightingale is basically on environmental theory, in which that will actually help and facilitate recovery of the patient. So the best answer here is letter A, Virginia Henderson. That's gonna be the 14 basic needs of an individual. So the best answer for number 37 is letter A. Let's now have 38. Miss Janet was proud to tell the graduating high school students that she enjoys being a nurse because of the many independent functions inherent in her practice. Which of the following is not an independent function of the nurse? Take note of the word not. An independent function of the nurse. A. Applying cold compress to a localized hematoma caused by fall. Letter B. Injecting quick acting pain reliever to a girl with severe dysmenorrhea. Letter C. Teaching a non-teaching personnel with diabetes how to self-inject insulin. Letter D. Referring a grade 1 pupil with speech problem to a special therapist. Of course, when you talk about independent function of the nurse, of course we know that we have your independent nurse-based intervention, dependent, that depends on the physician. Of course, we have your interdependent, that is going to be part of the collaborative interventions of the nurse. So in this case, not an independent, that is going to be eliminate natin diretso yung we're looking for a wrong answer here. So eliminate letter C and also letter D, because of course referring is part of the independent nursing function of a nurse. So in this case, not an independent intervention. So the best answer is letter B, because of course from the word inject, quick acting reliever to a girl with severe dysmenorrhea, that is part of the dependent intervention that is requiring doctor's order. Let's now have our 39th question. One student in the convocation asked, how can nurses prevent themselves from a malpractice suit? Which of the following would be the best answer? A. Always ask your supervisors before doing anything for the patient. B. Ask the watcher or relative to assist you in doing nursing care to a patient. Letter C. Always observe teamwork. Or letter D. Ensure competence through continuing professional education. So this is part of the first reading. Eliminate letter B immediately, because of course you're talking about watcher or relative to assist you in doing nursing care. Nursing care is done by nurses, and of course it will actually be the watcher or relative is not actually part of nurses. And also, if you're going to encounter the word always in a choice, that's gonna be 95% wrong. So therefore, always ask your supervisor, always observe teamwork. That's already a form of absolute terms. So the best answer for number 39 is letter D. Ensure competence through continuing professional education, or the continuing professional development, which is also mandated now for every professionals here in the Philippines, because of course that will actually improve competence level among professionals. Let's now have the last question for this set. Number 40. Which of the following is the main nursing function of a school nurse? Take note of the word nursing function of a school nurse. A. Develop programs to increase worker safety, health and safety. B. Provide a variety of health related to services within a designated locality. Letter C. Provide a health education and care for clients with non-emergency illnesses. Letter D. Teach clients and family to provide home nursing activities. Let's eliminate first reading. Letter A and also letter B. Letter A is basically for occupational health nurses, or the private duty, or the occupational registered nurse. Letter B, provide a variety of health related services within a designated locality. That's going to be for public health nurses. And of course, is it C or D? The best answer is letter C. Provide health education and care for clients with non-emergency illnesses, specifically in school, because of course that's gonna be the priority intervention of a school nurse. Letter D, teach clients and family to provide home nursing activities. That's gonna be focused on the role of a public health nurses. Okay, so I hope that you get the a perfect score of these questions, 20 over 20. So this is gonna be set number 2 of our pre-board examinations. So these are actually going to be part of the board exam essentials, or pre-board examination for nursing practice 1, questions number 21 to 40 of the former board questions. This has been a Nurse Jose at your service to make your best even better. Thank you.